Hello and welcome to Medical Point. Today we are taking a symptom that seems simple but is often doorway to much more complex diagnosis, anorexia or loss of appetite. Imagine a patient walks into your clinic, their only complaint is I don't feel like eating. Your first instinct might to be prescribe a general tonic or an appetite stimulant. But what if you are missing a critical clue? In this video, we are diving deep into systematic approach to anorexia, guided by Dr. Ghanshyam Vaidya's classic book, Clinical Practice. Step 1 is a safety check. Before you even think about treatment, the book says you must first rule out three things: jaundice, fever, and anemia. Checking for these immediately point out toward an underlying infection, liver issues, or hematological problems. If you have done that, the initial management can include more general support, things like injections of vitamin B like Neurobion, appetite stimulant, cyproheptadine, taken about half an hour before meals, and deworming with a single dose of albendazole, as worm infestation are a common cause of anorexia. Now for the most important part, the clinical detective work. The book has a brilliant section on important points may be missed. Your approach needs to change based on who your patient is. In a female patient, you must ask, is she pregnant? Morning sickness is a classical cause. Also, are there a psychological stressor at home? In school-going children, the cause might not be physical at all. Are there study-related or psychological problems at school? In adult males, you have to consider lifestyle. Is he an alcoholic? Does he use a lot of tobacco, mawa or pan masalas? And especially in elderly men, severe anorexia should make you think about a potential malignancy of the stomach or liver. And here is the single most important red flag from this entire chapter. If a patient has anorexia and nothing else seems to fit, the book states that pulmonary tuberculosis may present with only anorexia. This is a diagnosis you cannot afford to miss. So, if a patient isn't responding to treatment, an X-ray of the chest is a crucial investigation. Also, always check their drug history. Medications like metformin, digitalis, and metronidazole are well known to cause anorexia. So, let's quickly recap Dr. Vaidya's approach to anorexia. First, rule out the big three: jaundice, fever, and anemia. Be a detective. Consider the patient's age, gender, and social context. And most importantly, if anorexia persists without a clean cause, always keep tuberculosis high on your list of differential diagnosis. This systematic approach can make a huge difference in your clinical practice, helping you move from being a prescriber to a true diagnostician. If you found this guide helpful, hit the like button and make sure you are subscribed to Medical Point for more videos from our clinical practice series.